Joining us now from the Virginia Consumer Healthcare Alliance, their two co-chairs are former House of Delegates member Chris Peace and former State Senator Rosalind Dance. Both of them were defeated in primary contests for their renomination. I want to start with Senator Dance. I have to apologize. Senator Joe Morrissey is, as many people know, my best friend in the world, and so I was not particularly kind to you during that primary battle. I'm sorry for that, and I hope we can turn the page, Roz.
The page has been turned, and good morning, John.
Thank you. Also with us is Chris Peace. That was quite the opposite. I was 110% behind Chris Peace in that nomination, pissed off Scott Wyatt. Hey, Rosalind Dance, if you think I was not nice to you in that campaign, you should be on the Scott Wyatt side. That was pretty bad. I had to apologize to him also. So I was so mean to him, all the things I said. But we got to put all that behind us now. You guys are doing great work with the Virginia Consumer Healthcare Alliance, and I'm kind of excited about this, having concluded your service in the General Assembly, both serving now co-chairs of the VCHA, and we're going to talk about some of the things that they're trying to do. Let's start with Chris. What is the Virginia Healthcare Alliance? What are the issues that you're working on?
Well, John, first, thanks for having Roz and I on. I think this is a shining example of how Virginia politics works better than most places. There's always room to find common ground, and we're very excited about this project. The Virginia Consumer Healthcare Alliance, as the name indicates, is a consumer-focused healthcare advocacy group dedicated to issues that impact regular Virginians' ability to access and afford healthcare services. You know, because you're very knowledgeable about policy issues and politics in Virginia, but maybe some of your listeners don't. The Alliance has been around for 5 years and has thousands of members across the Commonwealth. So our goal, Roz and I and all of the members who are part of the Alliance, want to provide the general public with real facts, information that can help them have their voices heard so that they're empowered to be advocates for improving the healthcare system in Virginia. Healthcare has been a high priority issue for the legislature, for consumers, for many people in Virginia for several years. And the Alliance has already had an impact in that public policy conversation with Medicaid expansion. But now that healthcare access has been expanded, the next big issue to address is the rising health insurance costs that impact families and employers across the Commonwealth.
All right, so let's get to former Senator Roz Dance here, now co-chair of the Virginia Consumer Healthcare Alliance. Roz, health insurance cost, affordability, health insurance cost keeps going up. It doesn't matter what we do. You know, we had Obamacare, it went up, and we took away the mandate, still goes up. Every time we turn around, it goes up. How do you get from a state issue? How do you get Virginia involved so that we can bring healthcare cost, Roz Dance, under control?
Good question, John. I will tell you that what we see is that, especially from my role as a chairman of the Joint Commission on Healthcare, I was proud to serve in that capacity. And one of the things we continue to hear about was the balance billing and rapidly rising health insurance premiums and out-of-pocket costs connected to the high deductible insurance plans. And we have to, is that something that we need to address? It's something that we truly must address. What I will tell you, I've heard that the concerns about the health insurance rates seem to keep increasing. The insurance companies make billions in profits each year, yet the average family and small business owners continue to face growing insurance expenses, and that's just not acceptable. Here in Virginia, the average individual health insurance premium increased more than 140% in the past 5 years. And health insurance price increases continue to outpace both inflation and wage growth. We're just not making the money to offset the tremendous cost of health care, and that's something we need. We're pleased that we got that Medicaid expansion, but that's just the tip of the iceberg as far as where we need to go. there's more shocking stats, that your listeners should hear, John, as far as the average annual health insurance deductible for an individual in America is now at a high in the last 10 years. It's doubled. It's $1,600. Think about that. And the average median income for households here is just unacceptable. We're pleased we got Medicaid extension, but there's so much farther to go.
All right, so I guess, you throw some of these statistics out here. Anybody that's listening has experienced this. Rates have gone up for insurance here in Virginia 140% over a 5-year period. So, we got Obamacare, supposed to bring costs down. It didn't. Then we get Medicaid expansion, as you both know, was an advocate for that in Virginia. We got that done, 300,000 people on it. That was supposed to bring costs down. It didn't. So it seems like no matter what we do, cost keeps going up. So is there, and then we've got surprise billing. Like I got a bill for $7,900, comes in my mail. I have no idea what it is. I had a colonoscopy, polyps, 3 or 4 of them. They're not covered. Out of doctor network from what my insurance is. I get a surprise bill. I got to deal with that. So what? These things are driving people absolutely berserk, right? So you get surprise billing, you get no balance billing, you get no transparency from insurance companies. It depends on what insurance company has things are charged different. If you compare just hospital bills from one insurance company to the other, they're all over the board. So they're making the money. We're getting screwed. So I'm going to go back to Chris Peace. What is their legislation? Is there something in Virginia that we can do?
Well, John, you identified, I think, an issue that is really frustrating to a lot of Virginians. As you know, Roz and I are not able to directly advocate for legislation. We're providing information and education to citizens. But frankly, there are a lot of citizens that are already educated and has come through a lot of pain. And it's the type of experience that you had where you have insurance. You go for a procedure, the person providing it not in network, the insurance company doesn't cover the cost of the procedure, and then you get a surprise balance bill, often in an emergency situation. You're trying to get care. You're not going to be quizzing the provider about whether they're in network or out of network. So it is understandable that people have a reasonable expectation that if your employer is paying monthly premiums, you have an employer-based insurance, and money's being deducted from your paycheck, and you pay a copay or deductible, then the insurance company covers the things on its end. So that issue needs to be fixed because these are just ridiculous insurance bills. As you said, they're making the money, and the working folks who even have the good fortune to have insurance are getting screwed. And that is not something that any Virginian should tolerate. Balance billing is one of the themes of the new video that the Virginia Consumer Healthcare Alliance released this week that highlights some of those insurance issues. I'd encourage your listeners to watch the video. I think I heard it before we came on. It's only a minute. It's very powerful. They can put it on their social media platforms. It's Virginia, spelled out, virginiaconsumerhealthcare.org/news, virginiaconsumerhealthcare.org/news. It's a powerful video. I think it'll really drive home this point.
All right, I want to get to Roz Dance a minute, Roz. And again, thanks for doing this and coming on. And let me just ask you this. Like, everybody understands what surprise billing is, right? Because that means you get a bill in the mail. It's a surprise, and you got to pay it. And if you don't pay it, you get they'll take you to a jurisdiction. You'll get a judgment, and they'll garnish your pay. This is the way it works, right? I've talked to a litany of listeners who have gone through this. They've actually gotten judgments for an unpaid bill that they knew nothing about, couldn't pay, and now their wages are being garnished, right? Bad news. Everybody gets that. Balanced billing is a little more convoluted. People hear that like, what's that mean? Can you just explain what that means in layman's terms, Roz?
In layman's terms, as far as balanced billing, it says that if I have my insurance and I pay my premiums as required of me, then I assume that I can go and get service, and that I can go to emergency room, I can go to doctors, I can do whatever, and that's what I'm paying. But what happens is this is not the case. This is not the case in a lot of situations for us Virginians, and I'm like the consumer now, sitting on the side of just the average Virginian that has health insurance, but find that it is difficult, and the insurance companies can deny your claim. You're connected to claim denials when insurance companies refuse to pay for legitimate medical expenses. I've been on this earth for quite a while, and I can tell you a lot has changed in the healthcare system since my days as a working nurse and providing direct services to people. Right now, what you would think that you could get, and as far as services and changes, is outrageous. Prescription drug prices have made it impossible sometimes for people to get the kind of medications they want. They have to settle for, we just said, the off-brand Coca-Cola instead of a Coke that they really need, because there's just a little bit difference. And so what the Virginia Consumer Healthcare Alliance tries to do is we try to serve as a voice for people, just given the information to inform those who can make the decision, because as Chris says, we're not lobbyists. We are removed from that, but we can be voices based on the experiences we have, knowing that there's the drug costs rising, and insurance companies find not being willing sometimes to work with the hospitals to make sure that the prices and the cost of the services that we get is a true representation of what we should be receiving. There has to be more work between what happens when the person, I'm the consumer. I should not have to worry about if I have this doctor or that doctor or this procedure. If I've got my insurance, I should be able to walk in there, hospital, healthcare center, get the services I need, knowing that I have paid my the amount that I'm required to pay, and not get additional fees or say that this is denied because even though I have the insurance, that the insurance company decides that I'm too old or I'm too this or that for them to invest in what I need in services, and that's just not acceptable.
So let's get to Chris Peace here. So when we talk about balanced billing and surprise billing and just cost in general, basically the keys are, it seems like what you're saying is we have to get transparency in pricing, right? Is that really the key to this, Chris Peace?
I think that's one of the keys. We need to hold the big insurance companies accountable. That's number one. I've served on the Joint Commission on Healthcare for many years, and certainly Roz brought great experience with her background in healthcare to that body. And when Delegate O'Bannon was on the commission, for a decade, we've been trying to get greater transparency, trying to identify what true cost is as one component of that. We passed a bill several years ago for an all-payer claims database. What do you know? One of the biggest players that would push back on that transparency initiative was Anthem. So what are they hiding? I think it's very important that we drill down on that. I think, there are plenty of Virginians out there with stories to tell, some actually pretty tragic stories, and we just can't afford to, leave Virginians behind, particularly working Virginians, who have the good fortune to have insurance through their employer, but still are, middle-class folks with children that have bills to pay. They don't deserve that type of surprise balanced billing. It's a fairness issue, John. I think one thing that Roz and I have always shared in our public service is that it's about the people. And the people here need the help of the legislature, of the leaders of this Commonwealth to solve this problem.
You're on the John Fredericks Radio Network. We are with former State Senator Roz Dance and former House of Delegates member Chris Peace. They are co-chairs of the new Virginia Healthcare Alliance. They're not lobbyists. They're advocates for better health care and lower prices for Virginians. Let's get to Roz Dance. Roz, how does telemedicine fit into this? Is that a viable option where people could go to their doctor via their iPhone or Skype or something in a video, get the care they need without having to go in the waiting room and sit down for hours and all that stuff to increase the supply? Is that potentially part of this mix?
I agree 100% as a healthcare provider, and knowing that Virginians, wherever they are in Virginia, where in the rural areas where they do not have ready access, but they have the same needs, telemedicine is the answer for them, and as far as their abilities to mobily get to where they need. It makes it much more reasonable and sensible, and that's something that Virginia is moving toward, is involved, not moving towards. That's something that is happening and needs to be expanded upon. And I don't think there is any disagreement from either side of the aisle. That's one of the wonderful things about working with my friend Chris, is that it's a bipartisan issue. It's a Virginia affordable health care, quality health care, a position that we hold for all Virginians, and we don't look on either side of the aisle. We just look straight ahead as far as improving quality health for all Virginians, and being a voice to speak out where others might not be have access or not be willing to do so, but are frustrated.
Well, I have to say, it is kind of neat what you have done, Chris Peace and Roz Dance, getting together as co-chairs of this, certainly having served in the legislature a long time, opposite sides of the aisle, opposite chambers. It's kind of neat. You guys know what's going on. It is quite an alliance you've made with the Virginia Consumer Healthcare Alliance. Let me get back to Chris Peace a minute. Let's get to prescription drugs, right? Those are rising out of control. They represent about 1/10 of healthcare spending, and a lot of people now benefiting from generic drugs that come on the market. But some have said we ought to be able to buy drugs from Canada, knockoffs, and otherwise that'll bring costs down. What do we do about prescription drugs here, Chris?
Yeah, John, a great point to raise, along with the telemedicine point that you brought up. I mean, obviously, as drug costs rise, insurance companies, it's sort of like the same story all over again. They're picking and choosing what and how much to cover, and that's not fair. The predictability and the transparency is absent. You go to your provider. You may not go to your provider very often because you've got the medication you need, and so you're visiting the pharmacy more frequently than you're visiting your provider. I mean, just in the last year or so, prescription spending at pharmacies made up 9% of the total U.S. healthcare spending. So we know that people are consuming the pharmaceuticals that they need to keep themselves healthy, but they're also spending more for it. And that's an area we're also focused on. That's why I want folks to go to the Virginia Consumer Healthcare Alliance .org/news, see this video, sign up, get our emails, find out about information that will help them be better advocates for better and more affordable health care in Virginia.
Fantastic. Okay. I want to thank Roz Dance, former state senator, Virginia General Assembly. I want to thank Chris Peace, former House of Delegates member, Virginia General Assembly. Roz, a Democrat, Chris Peace, a Republican. They're now co-chairs of the Virginia Consumer Healthcare Alliance. Chris, if you would, give that website out again.
Sure. It's Virginia Consumer Healthcare Alliance.org. And then you can also go /news for the video, but it's Virginia spelled out, consumerhealthcare.org.
All right. Virginia Consumer Healthcare Alliance, right? Alliance.org.
VirginiaConsumerHealthcare.org.
VirginiaConsumerHealthcare.org. Okay, VirginiaConsumerHealthcare.org. Get the information there. Roz Dance, I want to thank you for being with us. I want to also thank Chris Peace and the Virginia Consumer Healthcare. Finally, we have advocates that know what they're doing to bring information back to Virginians to get these prices down. Thank you for what you're doing, guys, and thanks for being with us today. John Fredericks Radio Network, thank you both.